Project 25 is a public-private partnership with a mission of targeting chronically homeless people whose needs were great and who have been a huge cost to the city and county of San Diego. One year, a small group of homeless racked up millions of dollars in expenses between arrests, hospitalization, and jail time. Through Project 25, the partners, which include the United Way and Father Joe's Villages, say they've saved taxpayers a lot of money. They've also created opportunities for care and housing this group didn't see before. Joining me to talk about this are Mark Stevenson, Director for Project 25 at Father Joe's Villages, and Dolores Diaz with the Regional Task Force on the Homeless. And Mark, Project 25 began in 2011. Please describe the people you were targeting with that.
Well, there's a lot of homeless service providers in the city of San Diego that provide wonderful services to the chronic homeless. But the United Way had the insight to try to target a specific group of the chronic homeless who were the most highest cost and most frequent users of emergency services in San Diego. So we identified those folks by running lists with the hospitals and with EMS until we came up with a list of the 71 of the city's most frequent and highest cost users in the city of San Diego that were homeless.
Now, it's called Project 25. Did you eventually target 25 people, or was it more than that?
The name Project 25 came from the fact that the city of San Diego donated 25 sponsor-based housing vouchers for Father Joe's Villages to be the steward of in order to support the housing efforts. We served 35 people in the original project, and under a county-funded program called Telecare, they provided MHSA funds for the housing costs of the 10 additional folks. And then we ended up serving an additional person that was asked by the city medical director for us to serve, who was the highest user in the city of San Diego.
Okay, so 36 altogether. Now tell us how the program affected the taxpayer money that was going to this group.
Well, what we noticed over the years of 2012 and 2013, all said and done, we had a 67% reduction in emergency services use by this particular group by providing the services we provided. And that translated into about a savings to the community of about $3.5 million.
$3.5 million as a result of this. How would you say it affected the lives of the homeless?
Well, considering we were working with the people that were probably the most difficult to house in the city of San Diego, and considering that we were able to keep them housing, when they failed out of housing, get them into new housing because of the way the program had the freedom to be able to do this and follow these folks, it was a huge success. And the quality of life of those people improved as their emergency services and crisis situations decreased.
Dolores Diaz, tell us, who are the San Diego homeless?
You know, the homeless in San Diego have different faces. We're talking about individuals. We're talking about families, victims of domestic violence, youth. You know, it could be, it's children. The face of the homeless is quite diverse in San Diego.
What about the chronic homeless that was targeted by Project 25?
Well, we have, we do a count every year, and we know that approximately 30% of those that are unsheltered are chronically homeless. They self-report being chronically homeless. So the population that Project 25 serves is kind of a subset of that. It's a small group of that that need that intense services.
Like health care for mentally ill problems?
Yes.
Dolores, has Project 25 had an impact that is larger than this group of 36 homeless? Has it had a larger impact on the homeless population?
Well, we're very proud of Project 25. It does set a model for, you know, saving taxpayer dollars. We do know that permanent supportive housing is cheaper than having someone be homeless and be using the emergency medical services on an ongoing basis and frequently using those taxpayer-paid services.
Okay, finally, Mark, Project 25 targeted a small number of people with a big array of services. Is that the model we should use?
It's the model, as Dolores was saying a minute ago, it's the model we should use for this particular subset that needs more attention. And because they couldn't get this attention with traditional service delivery systems, had fallen through the cracks at the cost of the taxpayers.
Well, Mark Stevenson, Dolores Diaz, thanks very much.
It's a pleasure to be here. Thank you.
Pleasure.